Hello everyone, this is Paul from Ortho Eval, Pal, and with me I have Charlene today. And this is interesting because there was just a recent thread that came out regarding shoulder and palpating the biceps tendon. How do you determine if it's a bicep tendon? Is it a deltoid issue? Whatnot. So it's always very timely whenever these things come up. It seems like I have a patient with something similar. So Charlene's here. She's how old are you?
71.
71, and you've had this problem with your right shoulder for how long?
About 3 months.
3 months, okay. And you don't remember hurting yourself, that you didn't lift on something or push something really hard or anything like that. Can you tell me where your pain is?
Right here.
Okay, so pretty isolated to the front of your shoulder.
Yes.
Okay. Having a hard time doing overhead activities and things like that?
Right.
Okay. So what I did was I started by doing a cervical spine clearing test. She has good cervical spine range of motion. She does have a forward head and a rounded shoulder type posture. Okay, so you need to take that into consideration because that changes the dynamics of the glenohumeral joint. And then what I did was I went through some range of motion. She does have a positive Neers right there. She has a positive Hawking-Kennedy. She has no tenderness to the AC joint, and I've gone in there already and dug around. She has no pain there, no pain to squeeze it. And so then what I did was I did some manual muscle testing. Okay, this area you can get pain from the bicep tendon. You can get pain from the rotator cuff. You can get pain from both or just one of them. Okay, so it's very difficult to identify both of them. It is very unlikely that she has a deltoid problem. Deltoids do not cause trouble, okay, unless you have a massive fall on it and you tear that muscle or irritate it, bruise it, or anything like that. So first thing I do is I check her rotator cuff integrity. So I'm going to have you hold that arm right there. Don't let me push it in. Hold tight. Does that hurt?
Yes.
Okay, where does it hurt?
Right in here.
Kind of right in the front. Okay, so the external rotator is attached to the greater tubercle. I'm going to have you hold it right here. Hold tight. Painful also. Okay, let's go into flexion. Hold tight. Hold it up. How's that?
Hurts.
Okay, so all those hurt. Can you hold your hand up against your belly? Hold tight. Not bad. Okay, so the subscapularis attached to the lesser tubercle, and that's a very powerful, very strong muscle. The pecs also help internally rotate along with the lats and the teres major. So very seldomly is the subscap an issue. So she has pain with external rotation, flexion, abduction. So supraspinatus, infraspinatus, some teres minor. Take a look at her motion. Okay, so external rotation, not terrible. Okay, not bad here. We're going to check her internal rotation. Let this arm drop. Okay, not bad. Okay, check out this side. Relax your arm. Notice how that doesn't want to drop. Okay, her posterior capsule is quite tight. When the posterior capsule is tight, it sends the humeral head anterior, causing more impingement. Okay, so if I do a speeds test on her, I'm going to have you hold right here. Oh, I expect this to be a little uncomfortable. Feel that here also. So we've stressed her rotator cuff and we've stressed her biceps, and both of them cause pain. It's not uncommon for both of them to be uncomfortable. Now I'm going to palpate her biceps tendon. Okay, so I'm going to find her bicipital groove. Okay, that's painful.
Yes, painful.
Now the thing that tells me it's more of a biceps issue is if she has pain down toward the musculotendinous junction. So I follow that a little bit. Still a little painful. A little painful. Okay, and it's probably going to get less here. Okay, and that's better. So she's tender along that proximal long head of the biceps. But as I get to the subacromial space here, she's tender on both sides of the tubercles. Okay, so I think she has a rotator cuff impingement. She seems to have good integrity of her rotator cuff, and her biceps is inflamed. Now, a frayed biceps is a very big pain generator, so it's not uncommon for that to cause her a lot of discomfort. So what we're going to do is we're going to treat her in therapy. We're going to do I'm going to heat this shoulder up, we're going to stretch the posterior capsule, and we're going to start to work on re-strengthening the rotator cuff so that she has better humeral head depression and less impingement. If she does not show improvement with that in 3 to 4 weeks, we're going to recommend a subacromial injection to help decrease that inflammation and help her rotator cuff activate better. And I think she'll do really well with that. At this time, it looks like she has good integrity of her rotator cuff, and I think that she has some cuff impingement and some biceps tendonitis. And we're going to manage that conservatively for now and then go from there. But at this point, I see no need for diagnostic imaging. An x-ray could be helpful in identifying if you have arthritis, but you don't have a lot of noise in your joint, and I can move it pretty well, and it's kind of springy when I move it, so I'm happy with that. So I think we treat it conservatively first, and we see how you do. Thanks.